Did you know that a TIA, also known as a mini stroke, could be the warning sign of a full-blown stroke? If you don't act quickly, it could lead to irreversible damage. But what exactly is a TIA, and why should it concern you even if the symptoms disappear after a few minutes? Imagine this. One moment, you're going about your daily routine, and the next you suddenly feel dizzy, your face droops, or your speech slurs. These can be signs of a TIA. While it may seem less dangerous than a major stroke, it's actually one of the most serious medical emergencies. In fact, nearly 1 in 3 people who experience a TIA will go on to have a major stroke within a year. But here's the good news. Understanding what a TIA is and recognizing the symptoms could save your life. The earlier you detect it, the better your chances of preventing a full stroke. So how do you protect yourself? Stay tuned as I'll walk you through the symptoms, the causes, and most importantly, the steps you can take right now to lower your risk and keep your brain healthy. A transient ischemic attack, or TIA, is often referred to as a mini stroke. But don't let the word mini fool you. It's just as serious. A TIA occurs when blood flow to part of the brain is temporarily blocked. The key word here is temporary. Unlike a full stroke, where the blockage lasts, a TIA's symptoms usually clear up within minutes to 24 hours. So, what does this mean for you? The symptoms of a TIA are almost identical to those of a major stroke, including sudden numbness or weakness, especially on one side of the body, difficulty speaking or understanding speech, sudden vision changes, or even a loss of balance. In fact, these symptoms can come and go, which is why many people might think they've simply experienced something minor. But don't be fooled. TIAs are often a warning sign of a future, more severe stroke. The most alarming part is that although the symptoms may disappear quickly, the damage to your brain can linger, leaving you more vulnerable to future strokes. Studies show that people who've had a TIA are at a higher risk of having a major stroke in the future, sometimes within the next year. In other words, if you notice any of these symptoms, you should treat it as an emergency, even if they disappear shortly afterward. Time is brain. The sooner you act, the better your chances of reducing the risk of a full stroke. So let's dive deeper into how you can recognize a TIA early, and more importantly, what you can do to reduce your risk in the future. While a TIA may seem like an isolated incident, it's actually a sign that something is wrong in your body, specifically in your brain and circulatory system. Understanding the causes of a TIA can help you take the necessary steps to protect your brain health and reduce the risk of future strokes. One of the most common causes of a TIA is a blood clot that temporarily blocks an artery in your brain. This clot can form due to a number of factors, including atherosclerosis, which is a buildup of fatty deposits, plaque, inside your blood vessels. Over time, this plaque can restrict blood flow, causing it to clot. When the blood flow to the brain is interrupted, you experience the symptoms of a TIA. But it's not just plaque in your arteries that can put you at risk. There are several other contributing factors. High blood pressure, one of the leading causes of stroke and TIA. If your blood pressure is consistently high, it damages the blood vessels in your brain, making them more prone to blockages. Heart disease and irregular heartbeat, conditions like atrial fibrillation, AFib, cause the heart to beat irregularly, which can lead to the formation of blood clots that travel to the brain. Diabetes. High blood sugar can damage your blood vessels, increasing the likelihood of clot formation. Smoking. Smoking damages the walls of your blood vessels and increases your risk of clot formation. It also lowers the oxygen levels in your blood, which can exacerbate the problem. High cholesterol. Elevated cholesterol levels lead to plaque buildup in your arteries, narrowing the blood vessels and increasing the risk of blockages. While some of these risk factors are out of your control, like family history and age, Many can be managed or prevented with lifestyle changes. For example, controlling your blood pressure, quitting smoking, and maintaining a healthy diet can drastically lower your chances of having a TIA or stroke. This brings us to the next important point: how to make changes that will directly reduce your risk. Let's look at practical steps you can take to live a healthier life and protect your brain. Now that you understand the causes and risks associated with TIA, let's talk about the steps you can take to protect yourself and reduce your risk of having another TIA or even a full-blown stroke. The good news is that many of the risk factors for TIA can be managed through lifestyle changes. While it may sound daunting, making small changes over time can have a significant impact on your overall health and reduce your stroke risk. 1. Healthy diet. One of the most important things you can do to prevent TIA and stroke is to adopt a healthier diet. Eating foods that are rich in fiber, antioxidants, and healthy fats can help protect your blood vessels and improve overall cardiovascular health. Here are a few tips. Eat more fruits and vegetables. These foods are packed with nutrients that help reduce inflammation and improve blood circulation. Aim for a variety of colorful fruits and vegetables, as they contain different antioxidants that promote brain health. Reduce sodium. Excess salt can increase your blood pressure, which is a major stroke risk factor. Try to limit your intake of processed foods, which are often high in sodium. Healthy fats. Instead of saturated fats, opt for healthy fats like those found in avocados, nuts, seeds, and oily fish. These can help improve your cholesterol levels and reduce plaque buildup in your arteries. Limit added sugars. High sugar intake has been linked to higher blood pressure and the development of diabetes, both of which increase stroke risk. Try to cut back on sugary snacks and drinks. 1. Regular exercise. Physical activity is one of the most effective ways to reduce your risk of a TIA or stroke. Exercise helps lower blood pressure, improve circulation, and maintain a healthy weight. You don't need to run a marathon to get the benefits of exercise. Just aiming for 30 minutes of moderate exercise most days of the week can make a big difference. Start with small activities like walking, swimming, or even gardening, and gradually increase the intensity as you build stamina. 2. Quit smoking. If you smoke, quitting is one of the best things you can do for your heart and brain health. Smoking damages the blood vessels and accelerates plaque buildup, increasing your risk of TIA and stroke. It can be difficult, but there are many resources available to help you quit, from nicotine replacement therapy to support groups. 3. Limit alcohol consumption. Excessive alcohol consumption can raise your blood pressure, increase cholesterol levels, and damage your liver, all of which contribute to an increased stroke risk. Try to stick to the recommended guidelines for alcohol consumption. No more than 1 drink per day for women and 2 drinks per day for men. 4. Stress management. Chronic stress can increase blood pressure and contribute to unhealthy lifestyle habits like overeating or drinking. Finding ways to manage stress can significantly improve your health. Techniques like deep breathing, meditation, or even spending time with loved ones can help keep your stress levels in check. 5. Regular health checkups. Lastly, don't forget about the importance of regular checkups with your doctor. They can monitor your blood pressure, cholesterol, and blood sugar levels, and offer advice on how to manage your health. Regular screenings and tests can catch potential issues early, so you can take action before something more serious happens. By making these changes, you're not only reducing your risk of TIA, but also improving your overall quality of life. Remember, the key to stroke prevention is consistency. Even small adjustments can have a significant impact over time. If you suspect that you're experiencing a TIA, it's critical that you don't wait around for the symptoms to disappear. Even though the symptoms may go away on their own, You must take immediate action. The quicker you respond, the better your chances are of preventing long-term damage and lowering the risk of a full stroke. 1. Recognize the symptoms. First, it's important to know the common signs of a TIA so you can act quickly if they occur. The main symptoms to watch for include sudden numbness or weakness on one side of your face, arm, or leg, sudden confusion or trouble speaking or understanding speech, sudden vision problems in one or both eyes, such as blurred or double vision, sudden difficulty walking, dizziness, loss of balance or coordination. These symptoms may come on suddenly and can be temporary, lasting anywhere from a few minutes to 24 hours. But even if they go away, don't assume it's nothing. A TIA is a medical emergency and it should be treated as such. 1. Call emergency services immediately. If you or someone you know is experiencing any of these symptoms, dial emergency services 911 right away. Even though the symptoms may subside, you need to be evaluated by a medical professional as soon as possible. Time is critical. The longer you wait, the higher the risk of a full stroke occurring. When you call for help, be sure to provide as much detail as possible about what's happening. Let them know if the symptoms came on suddenly and if they've improved or gone away completely. The faster emergency personnel can assess your condition, the quicker they can provide the necessary care. 1. Go to the hospital for testing. Once you're at the hospital, your doctor will likely perform a series of tests to evaluate your condition and determine the cause of your symptoms. These tests might include CT scans or MRIs to examine the brain for signs of damage, ultrasound to check for blood clots or plaque in your neck arteries, blood tests to check for clotting factors or other abnormalities, electrocardiogram, ECG, to look for heart arrhythmias, which may increase the risk of clot formation. It's important to remember that just because the symptoms disappear doesn't mean the underlying issue has been resolved. Your doctor will want to identify the root cause of the TIA to prevent it from happening again. 1. Follow up with your doctor. Even after the symptoms of a TIA have cleared, you must schedule follow-up appointments with your doctor. They may want to conduct further tests, monitor your health, and adjust your treatment plan. If they determine that your risk of a stroke is high, they may recommend medications such as blood thinners or aspirin to reduce the chances of another stroke. Remember, a TIA is a serious warning sign. It's your body telling you that something isn't right. Taking immediate action can help you get the care you need and reduce the likelihood of a more severe stroke in the future. After experiencing a TIA, your healthcare provider will likely recommend a combination of medical treatments and lifestyle changes to help reduce the risk of a future stroke. While lifestyle modifications are incredibly important, medications and medical treatments can also play a critical role in stroke prevention. 1. Medications to prevent a stroke. Depending on your risk factors and the results of your diagnostic tests, your doctor may prescribe medications to prevent a future stroke. Some common medications include aspirin. This over-the-counter medication is often prescribed to help thin the blood and reduce the risk of clots forming in the arteries. It's often used after a TIA to help prevent another stroke. Blood thinners. Drugs like warfarin or newer anticoagulants, such as rivaroxaban or apixaban, are used to prevent blood clots from forming. These are typically prescribed if you have atrial fibrillation or other conditions that increase the risk of clot formation. Statins. If you have high cholesterol, statins may be prescribed to help lower your cholesterol levels, preventing plaque buildup in the arteries. Blood pressure medications. If your blood pressure is high, controlling it with medication is one of the most important steps you can take to reduce your stroke risk. It's important to take these medications as prescribed and follow your doctor's instructions carefully. Make sure you attend regular checkups so your doctor can monitor your progress and make adjustments if needed. One, surgical options. In some cases, your doctor may recommend surgery or a medical procedure to remove blockages and improve blood flow to the brain. Some common procedures include carotid endarterectomy. If you have significant plaque buildup in your carotid arteries, the arteries in your neck that supply blood to your brain, your doctor may recommend surgery to remove the plaque and improve blood flow. Angioplasty and stenting. In some cases, a balloon may be used to widen narrowed arteries, followed by placing a stent to keep the artery open. These procedures are typically considered if the risk of a future stroke is high and lifestyle changes and medications alone aren't enough to manage the condition. 1. Ongoing monitoring and follow-up care. Even after treatment, it's important to maintain regular checkups with your healthcare provider. They will monitor your condition and make adjustments to your treatment plan as necessary. This ongoing care is essential in reducing your stroke risk and ensuring that your health is continually improving. The goal is to work closely with your healthcare team to create a comprehensive plan that addresses both your medical needs and your lifestyle habits. By staying on top of your health, following prescribed treatments, and making necessary lifestyle changes, you can significantly reduce your risk of future TIAs and strokes. 1. The importance of prevention. Remember, prevention is always better than cure. By managing your risk factors, adopting a healthier lifestyle, and seeking medical advice when necessary, you can significantly lower the chances of a future stroke or TIA. A TIA is a warning, a wake-up call to take charge of your health and make the changes that will keep you safe in the long term. Now that you understand the seriousness of TIA and the steps you can take to reduce your risk of stroke, it's time to take action. Don't wait until it's too late. If you've had a TIA or are concerned about your stroke risk, it's crucial to consult your doctor as soon as possible to start on a plan that works for you. If you found this video helpful, share it with your friends, family, or loved ones, especially those who may be at risk. The more people who are informed about TIA and stroke prevention, the better equipped we all are to protect ourselves and our loved ones from a life-threatening event. And don't forget to subscribe to our channel for more content on health, wellness, and stroke prevention. We post weekly videos to help you take control of your health and live a longer, healthier life. If you're ready to take the next step, schedule a checkup with your healthcare provider today. Remember, your health is in your hands, and by making small changes now, you can significantly reduce your risk of stroke in the future. Take care, stay healthy, and thank you for watching. Don't forget to hit the bell icon to be notified when we post new videos. Together, we can make a difference in stroke prevention. See you in the next video.